Next, I'll outline a possible data collection workflow for you to follow. So let's look at new patients. So each week, you will review your clinic schedule to identify all lung patients who meet eligibility criteria. To do this, you will use console notes, planning directives, or any other resources you have to determine eligibility. If a patient is not eligible for the lung project, there's nothing else to do with that case. But let's say you have a patient that meets eligibility criteria. You want to do the following. You want to meet with the patient to discuss MROC with them, enroll the patient in the database if they agree to participate, facilitate the completion of patient pre-treatment forms and ensure you have the patient provider form ready to go. And then you can also go ahead and complete CDA baseline forms. During the patient's weekly treatments, you want to ensure the patient weekly forms and provider forms are being completed. During the last week of treatment, you want to ensure that the patient end of treatment form, end of treatment provider form, and the CDA L5 form is completed. If you like, you can also notify the MROC dosimetrist or anyone from your physics team that it's time to complete their form. And then you want to ensure that the patient is scheduled for all the appropriate follow up time points. When you're looking at your follow up cases, you want to review your clinic schedule to make sure that when your patient is returning, you know that they're coming back into clinic and that you can ensure that the forms are going out to patients. You also want to review physician notes to ensure that the patient is still eligible. If the patient no longer meets eligibility criteria, you want to submit an SE2 form or an early termination form. And if this patient is being termed within 1 year, you also want to make sure that the L11 and all other required forms are being completed in the database too. If a patient is still eligible for the project, then you would make sure that all patient, provider, and CDA follow up forms are being completed. Resources available for the lung project. Resources that will be linked in the module are the clinical tip sheet, a link to NCCN guidelines, and a link to the updated staging manual.